The last part of the Neoplasia lecture is on prevention and tumor marker. There are different modalities in the prevention of cancer. The first one that we will look at is lifestyle modification. Stop smoking cigarette is the most important factor that can prevent a lot of cancer. It can decrease the risk for cancer of the lung, esophagus, bladder, pancreas, throat, mouth, and cervical cancer. Increasing fiber or decreasing the dietary saturated abnormal fat can decrease the risk for colorectal cancer. Reducing alcohol intake can decrease the risk of laryngeal cancer, esophageal cancer, colorectal, liver, breast, mouth, and throat cancer. Another lifestyle modification is reducing weight and keeping a healthy weight. Obesity or increased adipose tissue can increase aromatase and conversion of androgen to estrogen, and this increased estrogen increases the risk for someone to have endometrial and breast cancer. Another important step in the prevention of cancer is immunization. Hepatitis B vaccination can reduce the risk for hepatocellular carcinoma. Immunization decreases the risk for hepatocellular carcinoma because hepatitis B can cause post-necrotic cirrhosis. Human papilloma virus immunization can also decrease the risk for cervical cancer, and this decreases the risk for developing cervical squamous cancer in particular. Another prevention modality is screening procedures. The most common one is the cervical smears for screening of cervical cancer. It can decrease the risk for cervical cancer by detecting the pre-malignant lesions or the atypical lesions. Cervical pap smear is most responsible for the decrease in incidence and mortality rate for cervical cancer. There are many other screening procedures, such as colonoscopy screening for colorectal cancer. This can detect and remove polyps that are precancerous. Mammography screening for breast cancer can detect non-palpable breast masses and pre-malignant lesions. Prostate-specific antigen screening for prostate cancer can detect prostate cancer. PSA may also be increased in prostate hyperplasia. Low-dose computed tomography for lung cancer screening can detect cancer in the lungs for people who have a history of heavy smoking and are between 55 and 80 years old. Another method to prevent the development of cancer is treating the conditions that predispose to cancer. The first one is treatment of Helicobacter pylori infection. That can decrease the risk for developing gastric lymphoma or gastric adenocarcinoma. Another is treatment of gastroesophageal reflux disease or GERD. That can decrease the risk for developing distal adenocarcinoma arising from Barrett's esophagus. Now we look at tumor markers. Tumor markers are biological markers that are secreted by the neoplastic cells themselves, or they are produced by the host in response to the neoplasm. Tumor markers can be used for identification of cancer because some cancer produce specific tumor markers. For example, the PSA is produced by the prostate. Yeah? It can also be used to estimate tumor burden. The bigger the tumor, the higher the level of tumor markers that are produced. It can also be used to detect recurrence. After removal of the tumor, we expect the level of tumor markers to be absent or very low. If the tumor marker level suddenly increases, you can suspect recurrence of the tumor. Last use of tumor markers is for indication of the response to treatment. After the complete removal of the tumor, you expect the level of the tumor marker to be absent or low. If there is poor response to treatment, the tumor marker level will be still very high. These are the examples of tumor markers. prostatic specific antigen for prostatic carcinoma, human chorionic gonadotrophin for choriocarcinoma, alpha-fetoprotein in hepatocellular carcinoma, carcinoembryonic antigen in carcinoma of the colon, and thyroglobulin in thyroid cancer.